Hi everyone, it's September 29th. I just wanted to give a quick update. I had an appointment with the doctor yesterday and there's not a lot of new information. So mainly the big news is that since we've gotten clearance from one vascular doctor that the blood flow in the lower legs is fine, we don't have to worry about vascular. So apparently it is true that you can have chronic dissection show up, like in my case, it was the two femoral arteries up high, and it can be benign. So if you ever hear that from someone, just know that the blood flow in the lower legs should be checked, because if it is interfering, then they need to intervene. But vascular doctors say that a lot of times it's benign, and as long as the blood flow is good, they do the ultrasounds, they check it in other ways. They don't do anything. There's no surgery. You don't necessarily have to have surgery, but you should have it checked if you ever find out you have that, if you have a CAT scan and that shows up. So it just depends on what's happening with the blood flow in the lower legs. So we are back at a place where we're focusing more on autoimmune. I'm focusing more on diet and doing the fasting around 15, 16 hours at night. I stop eating around 3 and don't start eating until about 7 the next day. So, doing that, and I will say I'm still on the IV antibiotics, but the wound is actually improving. A lot of the things that need to come off, the debriding, because this is probably autoimmune, surgical debridement is not really an option. Autoimmune wounds, if you do too much to them, to clean them, to scrape them, or do anything, autoimmune flares. So it actually will make it worse and make the wound spread even more, which is another big reason why, if you don't have a normal wound, or if you have a wound that for some reason can't be explained by vascular, can't be explained, if it's not healing and they can't find any reason why, really look at autoimmune as a possibility, because if it is autoimmune, you have to treat it differently. If you have a regular wound, doctors can scrape it and debride it, which is so much fun. Oh my god. It's horrible, but it will help the wound heal faster. But again, if it's autoimmune, it will make it flare and just spread even more. It's like setting fire to it. So keep that in mind if you know anyone or you're ever dealing with wounds. So the wound is improving. We're putting some topical treatments and things on it that when we pull them off, it's actually debriding the wound gently, so that we're not making it flare and get worse, but we're cleaning it. And it's working on most of the wound. There's one area that's still a little active. So unfortunately, it's close to the bone there, so I have to stay on IV antibiotics for sure for a while, because if anything is, if you ever have a bone infection at risk, I found out from the doctor yesterday, bone infections don't respond to oral antibiotics. You have to be on IV. They're not saying I have a bone infection, but the risk is there because it's close to the bone. So we have to just do it as a preventative. So things are improving. I should know more next week and the next week or two as I go to other doctors. So thank you so much for following. And I'm going to try to also post some other videos looking at other things and a new quote of the day and maybe some fun stuff. We need to do some fun stuff. The weekend's here. So I hope you all have a really great weekend. Sending lots of love.